Over to you, Hamda.
Okay, can you hear me? Okay. Hello, everyone. A very warm welcome to today's webinar. I'm really delighted to have you all here with us for this important session, which is organized by the Facebook group, Pakistani Women in Ireland, and the Irish Pakistani Professional Association, also known as IPPA. For those of you who do not know me, my name is Hamda Ajmal, and I'm the founder of Facebook group Pakistani Women in Ireland. I started this group back in 2017 as a small community space, and today it has grown over into this vibrant community of more than 3,000 Pakistani women living across Ireland. Over the years, this group has become a trusted resource for sharing information, for supporting each other, for raising awareness on topics like career guidance, health issues, and normal day-to-day routine issues as well. ये वेबिनार हमने इसलिए ऑर्गेनाइज किया कि आए दिन हमें ग्रुप पे ये क्वेश्चन आता है कि मैंने पाकिस्तान से फार्मेसी की डिग्री की हुई है या फिजियोथेरेपी की डिग्री की हुई है और डेंटिस्ट्री की हुई है और हम आयरलैंड में किस तरह से लाइसेंस लें और किस तरह से जॉब स्टार्ट करें तो हमें लगा कि देयर इज अ रियल नीड फॉर क्लियर एंड रिलायबल गाइडेंस सो वी हैव ब्रॉट टुगेदर प्रोफेशनल्स हु हैव ऑलरेडी वॉक्ड दिस पाथ एंड आर हियर टू हेल्प यू टुडे We are also very, very thankful to Irish Pakistani Professional Association, IPA, for their support. IPA is the only representative organization of all Pakistani professionals living across Ireland, and it plays a key role in career development, mentoring, and community engagement. Today, we are joined by three brilliant panelists, Dr. Salma Naz, who is a dentist, Afifa Ashraf, who is a physiotherapist, and Gule Lala, who is a pharmacist. They'll be sharing their personal experiences, practical steps to get licensed, and useful tips to help you get started in your field. But before we begin, there are just a few housekeeping notes. Please keep your microphones muted throughout the session. We also request that you keep your cameras off. And also, just to inform you that this webinar will be recorded, and the recording will be available later on. If you have any questions, please type them in the chat box and we'll address them during the Q&A session. मैं इसको उर्दू में भी रिपीट करती हूँ कि आप प्लीज अपने माइक्रोफोन्स म्यूट पे रखें, अपने कैमरास ऑफ रखें. वेबिनार की रिकॉर्डिंग आपको बाद में मिल जाएगी और अगर आपके कोई क्वेश्चंस हैं तो आप Q&A मैसेज बॉक्स में उनको टाइप करें और हम आखिर में तीनों टॉक्स के बाद उन सवालों को एड्रेस करेंगे. Again, thank you so much for joining us. We are so glad you are here and we hope you find this webinar helpful and insightful. So to begin with our talks, our first speaker is Dr. Salma Naz. She is a highly respected member of our community and a practicing dentist in Smiles Dental Dublin. She is one of the first and the very few Pakistani professionals who successfully acquired a dental license in Ireland and has been practicing here for over a decade. Her journey is not only inspiring, but is also incredibly valuable for anyone hoping to follow the similar path. We are so honored to have her here with us today to share her experience and insights. So over to you, Dr. Salma, and all the best.
Dr. Salma, you are on mute. Can you unmute yourself?
Assalamu alaikum, everybody. I'm Salma Naz. Just a second, please.
It's okay, take your time.
Yeah, the slides are... I can't move the slide here, please.
मैं इतनी देर में बाकी सबको दोबारा रिमाइंड कर लूं कि अगर कोई क्वेश्चंस हैं तो चैट बॉक्स में लिखते हैं और हम लोग आफ्टर दीस टॉक्स वी विल address those questions after these talks.
Sorry about that, guys. I just want to share my screen and my presentation. Yeah. Can we, Hamda, I think we can go to Gul or Afifa, anyone who is ready, and I can do it after. That's okay.
Okay, no problem. Or do you want to take some time or?
Or yeah, just my presentation is a bit stuck.
Okay.
I'm so
Um,
sorry.
No, that's fine. Um,
I'll go. I'll start sharing
okay.
my screen then.
Okay, yeah, let me introduce you, Gul.
Yeah.
So, guys, sorry for that. There's a brief technical glitch. Hopefully, this will be sorted soon. So, Dr. Salma Naz will go next. Let me introduce Gulilala, who is a pharmacist. She's currently working in Dublin. And Gul has an incredible story of determination and resilience, and she navigated this very challenging process of sitting pharmacy exams in Ireland, all while balancing life as a young mother. इनका छोटा सा baby है. The third baby has just arrived a few weeks ago, and despite this busy routine and demanding time in her life, she generously volunteered to be a part of this webinar. So thank you so much, Gul. I have huge respect for your dedication and your willingness to support others through your story, and we are so
so much.
grateful to have you with us today.
Thank you.
Over to you, and you can share your screen, and hopefully it will work this time.
Thank you. Thank you so much, Hamdan. Assalamu alaikum, everybody. Just let me share my screen now. Entire screen. Share now. So, my name is Gulilala, and I am a registered pharmacist in Pakistan from Pakistan. I got my registration done in 2014 in Punjab, and I came to Ireland in 2015. I applied for this registration in 2017 and got my registration, all like exam and everything, done in 2019. Currently, I'm working as a supervising pharmacist in a community pharmacy, in an independent pharmacy in Dublin. So the scope for the pharmacist Ireland is very high, and it's very good at the moment. Once you get your registration done in Ireland, you can work in any sector like a community pharmacy, hospital pharmacy, or industry pharmacy. And as I said, the demand is high. Once you're registered in Ireland, you can even get like a starting base pay of 60,000 euros per annum. And the best part is you do not require any experience from Pakistan. So you get your experiences in through, like when you're doing your registration, you get your experience, and that is considered as experience in Ireland. To apply in Ireland, the first thing you need from Pakistan is you have to have a PharmD degree, and the degree should be for 5 years. And the degree should be including a 6-month training. Like it can be two types of training which should be done. Like it should be it can be a 4 years educational year and 6 months training, or it could be a 4-year educational year and 1 year of training. Like you have to have a 6 months of training in a patient facing setup in a hospital or a community pharmacy. To register in Ireland, you have to be registered with PSI. That's a legal requirement. And the website is on, I have attached a link of the website on my slide here. And also the picture of this, of the page of the website is on my right. You can register your, get your application from there. To explain you a little bit of the registration process, the process is a 4 stages process. The first one is your documentation verification. Your second is your equivalence exam. Your third is an adaptation, which is a training period. And the fourth is a pre-reg exam. I'll elaborate them one by one. So the first one is a submitting of your documents. So you apply, you get your application form from the website, and then you apply a non-refundable fees of 1,500 euros to PSI. The 3 main documents which you need from your from Pakistan are your license from your pharmacy council, your degree from your university, and your good character certificate from the pharmacy councils as well. There are other support documents which you need. There is a list of documents. When you download or print your application, you'll find them at the back of the application, which you need to attach as well with the application. Once the verification process is done, you will get an email from the PSI for your exam dates. So exam dates are in May or in November. The exams are just to test your like knowledge how about your pharmacy degree. Is it equivalent to education in Ireland? So the exams are more like MCQ exam and OSCE exams. So you have to pass those exams individually. The MCQs, you get 4 sections of MCQs. The first section is like clinical pharmacy. Second is your hospital pharmacy or general pharmacy. There is a section of calculation, and there is also pharmacology side of the where you can be asked and get MCQs over from that section as well. The OSCEs is 6. You get 6 OSCEs from in the equivalent exam. 6 are live, and 12 OSCEs in your equivalent exam. 6 are live OSCEs, and 6 are inactive OSCEs. And these have to, this is like you do a Viva in your PharmD, but it's like more face-to-face kind of exam. Once, like when you pass your exam, then you get an adaptation period. Adaptation period is like a training period. It's like you are a student pharmacist and you are under the supervision of a tutor pharmacist, which is an Irish pharmacist. And this adaptation period can last from 6 months to 3 years, depending on how you perform in your equivalence exam and what was your clinical experience in back at home in Pakistan. When these 3 steps are done, there is a stage 4, which is a pre-reg exam. Pre-reg exam is, again, it's an MCQ and an OSCE exam, and you will be doing that with the same students that Irish students do in RCSI. Once you're gone through and pass all those stages, you have to give an English competence exam. Do not do that exam before when you apply for your application, because this exam is only valid for 2 years, and sometimes this process takes more than 2 years or 3 years. I have done my process in 3 years, so just do it when you are in the process, or maybe you are in stage 2 or stage 3. So just leave it for the end. And for the people who, sometimes I get the question how people can come from Pakistan to here. If you are watching me from Pakistan, then there are 2 ways you can come from Pakistan and do the exam. First is get a admission in a master degree, master course, and come here and do the master course, and also you can sit for do the registration in the meantime. And secondly, if you don't want to come here, you can apply from Pakistan and get your dates and everything from Pakistan and just apply for short visa and come here. And people who are already in Ireland, they have to, it depends on your IRPs and also your environment permit, how you can work in Ireland. And that's it for now. Thank you so much. Any questions for me can be asked at the end of the session. And that's it from now from me, Hamda.
Thank you, Gul. This was very nice, very comprehensive, and seems like quite a complicated process, but I'm so glad that you did it. And I hope that people who are listening to you will find some useful information and inspiration as well. So who is going next? Okay, so Dr. Salma again. Let me introduce her again. Dr. Salma is one of the first and very few Pakistani dentists working in Ireland. She has been working here for 10 years now, and is very well known and highly respected in the community as well. So, Dr. Salma, are you ready?
Monica, yes, I'm ready. Just give me a second. Let me.
It's okay. Take your time. Take your time, guys. If you have any questions, again, type them in the chat box. And please try to specify the specialty as well. So if your question is about dentistry, if it's about physiotherapy, or if it's about pharmacy. So for today's session, we are dealing with only these 3. We are not discussing MBBS or medical doctors. We are discussing these other healthcare fields today. So please specify कि आपकी question किस field के बारे में. I think
Hamda,
Dr. Salma,
just
your presentation is working now. Yay. Okay.
Yes, it
Okay,
is.
awesome.
just before Dr.
Okay,
Salma
oh,
goes, I have a quick thing. Sorry about that. The participants who are trying to join says it has reached the maximum capacity of the webinar. They will be allowed to join if somebody leaves. I'm getting these messages. So if you could look into that, Mustafa, please.
okay. We'll look at it and while Dr. Salma is doing the talk. Okay.
Assalamu alaikum, everybody. Sorry, there was a glitch. Now it's all sorted. I'm Salma Naz. I'm Salma Naz, and I did my exams back in 2008 in Ireland with the Irish Dental Council, but I'm originally qualified dentist from Pakistan, National Medical College, Pakistan. I've been practicing since then with a couple of private corporates. I'm passionate about supporting Pakistani graduates on their journey. I'm one of the executive of Irish Pakistani Professional Association called IPPA. I'm one proud member. It has been working and supporting with all the professionals, including doctors, engineers, tech, non-tech. It's a one democratic organization. That's why 50% of the house bearers are women. Now, the basic requirements that we usually do in Pakistan: 4 years of basic qualification, BDS degree, and 1 year house job, we call it vocational training. Now, what Irish exam entails of, it's Dental Council of Ireland exam. It has two parts. Part one is usually in March and April. Part two is usually in June and July. All the informations can be found on the Irish Dental Council website. And the exam requirements, basically, it's either 3 years post-grad experience. So if someone has done BDS, they have to be working 3 years after their graduation. So the 1 year house job includes that. It's included in that 3 years experience. But if someone is under, say, for example, their experience is less than 3, since they have graduated, they should be continuously working. Another requirement is IELTS. So in each band, they have to score 7, or you can get a letter from your university stating that it was taught and exam was in English. The fourth thing that you need is good standing certificate from Pakistan Medical and Dental Council. And the other part is you need 1,500 euros to actually pay for both parts. That's non-refundable. Now, by the time when I did exam, there was no such requirements. Anybody from anywhere could actually apply for the exam. They could get through the exam. But now with the recent changes, they have made only 80% quota is for those people who are sitting the exams who are actually residing in Ireland, whereas 20% are for the non-Irish residents. That's a big change. So I'm like, it has made it a bit difficult for those who are actually living in Pakistan. So what people do, and what I see in my clinical experience, that a lot of people, they get into any master's course, and then they get into a job. They are allowed to work 20 hours a week. Most of the clinic I am working in for the past, I'm like so many years, out of 10 nurses, 7 and 8 of them are dentists from home. And that's how this experience that they have availed with us, they have learned with us, it goes towards their dental council exam. Now, what part one consists of? There are 3 papers, which are written papers, and it make your hand actually very, very tired, because 3 hours each, a week-long exam. You are aware that there are only 2 limited attempts that you can, if you pass, you qualify to sit part 2, but if you don't, you are actually disqualified. So it has made it a little bit difficult, but it's not impossible. It's not hard. If I could do it in one first attempt, anyone could do it as well. So the 3 papers that actually is health, disease, society. In health, it includes basically anatomy, dental anatomy, neck anatomy, oral anatomy, histology, and oral physiology. In disease, obviously, it's including but not limited to immunology, medicine, microbiology, pathology, pharmacology, surgery, and society, which again, law and ethics, that's the most important part. We are never trained in Pakistan. Well, I wasn't, and Nishtar is one of the prestigious institute in Pakistan. Law and ethics, regulations in dentistry, dental public health, all these things, you are thoroughly questioned and grilled about it. If you don't know them, you can't work. You can't actually proceed to part two. Now, the most important part of the part one is a bench test. What bench test consists of? A bench test is actually the key element of part one. That's the test that actually students, graduates they are examined about their operative dentistry, how they do it. But it's usually held in Royal College of Surgeons, Ireland. They will have all the nurses, all the support from the examiners, but they have to do, it's an hour-and-a-half test. In hour and a half, they have to prepare a class 2 cavity. They have to fill that cavity, but it's over on the mannequin head. It's just like a proxy to treat the patient, basically. And they have to prepare a crown. They have to make a temporary crown. And the information about this bench test is also all available on the Irish Dental Council website. Previously, when I was here, when I came to this country, which is back in 2007, and I did my exam, as I mentioned, in 2008, we didn't have any support, but now they are conducting a course. I think the value is around €2,000. It's held in Royal College of Surgeons, and they actually prepare the students, the candidates who are sitting the exam, for the bench test, which is the practical aspect of the part one. Now, remember, if you fail any of the above theory paper, you just have to repeat the whole exam. It's not possible that you do that one paper and you move on. No. But yes, if you pass the theory and you fail the bench test, you again have another chance to sit the bench test along with your part two. Now, for part two, there are again 3 papers, usually held in June, July, either in Dublin or in Cork. Again, anyone who is among the audience who are dentists, they will know operative dentistry, prosthodontics, endodontics, periodontics. It has 1 paper, again, 3 hours long, and a short answer and questions. They actually assess that the candidate who is going to be a working dentist, getting a full license, how good he is dealing with all these operative, prosto, endo, and perio. Second paper, which is again very important, is periodontics and orthodontics. Basically, back home, we are examined separately for these. We would have pediatric dentistry, or maybe that didn't even exist. But because when the child is growing, you can do an interceptive orthodontics. So there is the second paper of orthodontics and periodontics. The third most important is oral surgery and oral medicine. Well, anyone who is listening to me, dentists who cannot pull the tooth out, cannot practice dentistry. So oral surgery is important, and they are actually, as one of our professors used to say, that when you are looking at teeth, you just don't look at teeth. You have to examine the whole patient, the whole face, the mucosa, the oral cavity, and also the face. Sometimes patients come with different syndromes and they have facial asymmetry. You need where to refer your patients to. Then the fifth important part is Viva and OSCE. Now, Viva, all of us go through Viva exams back home. This Viva is a bit different. You will be actually having a patient on the chair. You will be given half an hour to examine, take a history. You will be having a nurse by your side who will be actually writing all the documents, all the notes. Then you'll have to go through all the X-rays. The patient might have any underlying health disease, might have a root canal done in any other country which is not properly done. You need to look at every detail, and a pair of examiners, maybe 3, 4 in my case, as far as I remember, some 4 examiners, they would see how you presented the patients, how you approach the patients, how you took a history, and they will question you. Say, for example, if patient's on any medication, what medication you can prescribe or where the patient needs to be referred. The sixth part is asking. So you will have to go through. In our time, it was, I'm pretty sure it's the same now, 14 to 16 stations. There will be some rest stations as well. You'll be given a case, you will be shown a slide, you'll have to diagnose it, you'll have to manage it, and you'll have to give the treatment plan. Now, anyone who has been through, who has done the part 2, obviously you can do the part 2 after you have passed the part 1, then you are actually entitled to get a full license. Now you have all the freedom. You can have your own surgery set up. You can work either in health services executives, or you can work as an associate, as I myself am working with one of the organization called BUPA. It's called Smiles here in Republic of Ireland. They have change of practices. It entirely depends on yourself. For me, working in HSC has never been a choice, because HSC, they only deal with kids. You'll be either anyone who wants a bit easy life, they go to HSC because they can get 86,000 per annum. They can get paid holidays. They can get all the perks, and they can get a pension. Whereas I work as a self-employed. I have a freedom of working 3 days or 2 days or one day a week. But yes, my status is self-employed, and I have that freedom too, that I can practice in each and every aspect of dentistry, be it orthodontics, like my special interest has always been orthodontics with all my whatever post graduations that I've done. I can do Invisalign, I can do cosmetic dentistry, I can do fixed braces. If I wish, I can turn my direction towards prosthodontics. But as I said, it all depends on personal choice. But then, yes, if someone who is actually seeing us from far, from Pakistan, we are here to support and we are here to help. If you have done your exams from Pakistan, just to give you a bit of an insight, you can come to Ireland with a sponsorship visa. People will, like those who are principal dentists or who are corporates, they'll give you full indemnity. They'll give you 64,000 euro a year. You will work as an employee for 2 years, and then your status change from whatever visa status to stamp 4. It's then when your options open. You can switch job, you can go to HSC, you can work as a private dentist with anybody, especially those who own surgery. So these are the pathways to come here. Now, again, one advice, what I did, all the syllabus, everything is available in Pakistan or anywhere who is listening to me all over the world. I'm pretty sure some of my friends, and they have actually joined from Brazil. I'm not sure if they did, but then what my advice to them would be, what I did was, if your basics are strong, believe me, this exam is not tough. And why it looks tough? Yes, you just cannot come and try the exam and then lose a chance, because it gives you psychological stress a lot more than, oh, I'm left with one attempt, what I'm going to do. Yes, you don't have a career. You don't have a career. I know so many of Pakistani women who came before I came, and they did 5 years. 5 years, what I mean that they did 2 attempts of part 1, they passed the part 1, then they did 3, because this exam is held only once a year. Then they did 3 years again in a row, part 2, and couldn't do it. Now either they work as a nurse, or they obviously they can't work as a dentist here, which is a bit unfair, I feel, as compared to doctors, because doctors have unlimited attempts. But yes, it's easy. I followed all my basic books, what I studied in my undergrad. Yes, it's not that I didn't buy more books. I did, and I loved them. But I actually focus on what I had. And neck anatomy doesn't change. Mouth doesn't change. Tooth morphology doesn't change. You need to know. And believe me, all those dentists who are staying in Pakistan, working in Pakistan, we got so many patients, so much work. What benefited me, that I had probably an experience from Pakistan. It was so easy for me. I had only 3 weeks between my part 1 and part 2, and I did it. I was so, I was lucky that I just went ahead, and then I have started my career. Since then, I'm enjoying what I'm doing. Thank you very much. Any questions, you are more than welcome. I'll be happy to guide as many the students from Pakistan or all over the world who wants any kind of guidance. I'm all here. I hope some of the dentist colleagues that actually back in 2011 and 12, I helped a little, and mashallah, they are doing so well. And I'm so happy that they are actually mentoring so many students, be it from Pakistan, be it from India, be it from anywhere. I'm so proud of them. Thank you all.
Thank you so much, Dr. Salma. This was such a nice talk, and I think you touched a lot of important topics here. Sabse pehle to this was a good thing कि we know that 80% of the people who are resident in Ireland they have that quota system. So it really benefits those who are here, who have BDS degrees from Pakistan, who are living here for if they're on a student visa or if they're on a spouse visa, so they can really use that opportunity to sit their exams and get license. And the secondly, what I really liked about your talk was when you, क्योंकि हम लोगों को पाकिस्तान से कभी कभी लगता है कि हमारा इतना एक्सपोजर नहीं है, हमारी इतनी नॉलेज नहीं है, बट वी डोंट रियलाइज कि जो पाकिस्तान में जिन्होंने प्रैक्टिस की होती है, दे हैव एक्सपोजर टू सच अ वाइड रेंज ऑफ थिंग्स. So they can use all that information and that experience and that knowledge very positively and be very confident while sitting the exams. Exactly. And as you said, that the anatomy is same, the morphology is same. Nothing. So if you have, so if you have really strong basics, it shouldn't be too hard to sit the exams. And
the only advice the only other advice that I would just give people, a lot of people, they think that if they have done masters or MDs, they can just come and practice dentistry. It doesn't work. They have to sit the license exam in order to be eligible to practice dentistry.
I think that's very important because without all these exams, unfortunately and unfortunately, without all these exams, it's really hard to start working as a dentist. So जो ख़वातीन और हज़रात यहाँ पे spouse visas पे हैं जिनके पास BDS की degrees हैं, I hope they'll take inspiration from your talk, and I hope they'll start preparing for their exams as soon as they can. And all the best to everyone who is trying to achieve this. Our best wishes are with you.
Thank you very much. Thank you.
So finally, we have Afifa. Afifa is a physiotherapist, and she has been incredibly passionate about this project from the very beginning. This project means this webinar that we have organized. Afifa was very eager to be a part of this webinar, and she has put a lot of thought and effort into preparing her talk. And Afifa has already helped so many people in the past by sharing this information informally, but today she is here to do the same on a larger platform. I commend her enthusiasm and her commitment to supporting others truly. And we are so excited to hear from her. So Afifa, over to you, and you can start sharing your screen. And you're there. I can see you here. Okay. All the best.
Assalamu alaikum, everyone. Thank you so much, Hamda, Gulilala, Dr. Salma. Very nice talk. Really enjoyed it thoroughly. So let's start with myself. I'll start sharing my screen now. Everyone can see, yeah?
Yeah.
Yeah, good to go. Right, so my name is Afifa Ashraf, and I'm a senior physiotherapist in pediatrics and MSK in Ireland. I have worked in multiple fields. I have worked in nursing homes. I have worked in MSK. I have worked with the teams, different sports team as well. I have worked in the hospital settings, neuro, but recently I am working in a public setup for pediatrics, and I'm also working in a private clinic for musculoskeletal injuries, including sports. So I graduated back in 2015 from Pakistan, and I came to UK and then in Ireland in 2016. And around about the same time, I started my registration and recognition process. It was a very, very new process at that time. One thing that in Ireland and UK, physiotherapy is a 4-year degree, and in Pakistan, it's a 5-year degree, that is Doctor of Physiotherapy. So it was kind of different here to get yourself registered. So it took some time and effort, and I will walk you through that today as well. And also, I graduated from the University of Islamabad in Pakistan. So first of all, why Ireland, and why would I encourage or people like me to work in Ireland? Firstly, it's a great country to raise your family, or even if you want to live for yourself. And the scope of physiotherapy is great in Ireland. There is a huge job demand going on for physiotherapists, and so where you can work. So many people don't know, not just nursing home or hospitals, you have other more areas to work in. For example, you can work in hospitals being part of the big teams, and you can work in private clinic, as I do myself as well, treating MSK, neuro, whatever area you want to do. And then you can work in community healthcare centers, sports and fitness centers. You can also train for rugby team, sports team, etc. And you can do academia research as well. So we have wide range of variety to work in Ireland. So what is the process to get there? So I get questions all the time, how to come in Ireland. So I want you to all to zoom out your head there and then just go to the first process, which is Kuru. Before you start looking into how to come in Ireland, how to apply for the job, zoom out everything. And the first process will be Kuru. And this process you can do while you are in Pakistan. So you don't have to come here to do the exam or do your practice. You can start doing it when you are in Pakistan. So what is Kuru? Kuru is a regulatory health and social care professional body. Basically, it is supervising all the healthcare professionals, including physios, radiographers, or speech and language therapists, social workers, and everyone. So regulatory body for health and social care professionals in Ireland that ensures the highest standards of practice and education. And why it is important? It is a legal environment, and it protects not only the patient but professionals like us ourselves. I have given the website link which goes step-by-step guideline how to register and it's an amazing website. There is a step-by-step procedure, and I have extracted all this data from the website, as you can see on the right hand side. So Kuru has basically two processes: qualification recognition and registration. From November 2024, this has all come in one domain. So it will be one application going on forward for recognition and registration. So how to do Kuru? We will go step by step now, okay? So the first step will be eligibility assessment. So go back and first you see yourself, if you're eligible yourself to apply for Kuru. First, you must have done your graduation from Standard University, which is registered, which is registered with the HSE, and it is verified, right? And it must have a teaching hospital or a clinical setup with it to practice, right? I have seen so many students getting the rejections because they did their graduation from ABC University, which did not even have a proper practice area or a teaching hospital, and now they're not getting their registration. So please make sure if you have done it, or if you know someone who's going to do a graduation, make sure there is a teaching hospital with it. And then your clinical hours are suffice. I will go through that in detail. And then you submit your application, and then you fill your assessment fee, which is with qualification recognition and registration is 510 euros. What are the key requirements? So as I said, you have to get your qualification verified, right? So all the qualification, you get it verified through your university. You get all your documents of your clinical placements, your theory, all your practical, viva, how did you go through everything, what was the mode of study, what was the mode of examination. You have to put every single thing in the document. Then proof of practice, where did you practice, and the proof is there. For example, any internship, any CPD that you did, any extra course you did, your basic graduation, anything you did, it should be there and it should be verified. Your English proficiency, so you are proficient in English. As we all know, we all have studying in Pakistan, India, Southeast Asia, any countries, more or less we all have good English, but we need to give a proof of that. I'll go through that, what it will be. Okay, and then the payment. So the English, that is, I said already, 510 euro. For English proficiency, I will go in the next slide. So what are the important notes? So first thing, ensure that all your documents are certified, as I said previously. Now, calculate your clinical hours accurately. I cannot stress this enough how important it is, because we all know for basic degree to get qualified, you need minimum 910 hours, right? But maybe go up more than that. So before they come back to you with any lag or any discrepancy in the hours, make sure before you submit your application, you are calculating your hours. For example, in one semester, you did, most of the physios, they start doing their clinical hour placement from I like to believe from 4th or 5th semester. So calculate from them that in MSK, in OPD, you did 3 hours this week or 12 hours this week, and you calculate them. It is a very long and hard process, but it is worth it. And also divide your hours between 3 areas. I know we all have done MSK, pediatrics, integumentary, general surgery, medicine, but Guru is going to look at 3 things, which is your cardiopulmonary, neuro, and musculoskeletal. So make sure you're satisfying these 3 areas. You have your 910 hours in between these 3 areas. Then add all the degrees, internship, CPD, and research projects. Whatever research project you have done, you will give a summary to them as well. This is all in the form, step by step. Please do not feel overwhelmed that I'm talking something alien. This is all in there, step by step. I'm just giving you a summary of all what his website said. For verification and background check, provide official email ID or headed letters. So, for example, if they all are going to do the background check from your university where you have practiced whatever you have done, so make sure you're giving them a website, not saying that Afifa Ashraf at hotmail.com or yahoo.com, or it should be a proper email ID. For example, afifa.ashraf.ed.eu.pk, for example, a proper university website or a hospital or a clinical website. Now, I understand many clinics might not have an official email ID, so maybe give them a headed letter paper. So, for example, you're going to give them your internship experience. So ask your clinic to give you a headed letter paper and write and type in that, and then you get it verified. And then contact Guru if you're unsure. If there is any information that you're not entirely sure about, please email Guru and they will walk you through it. So very important slide. So the documents I talked about, let's talk about them a little bit in detail. So your academic transcript. So all the official transcripts of your educational qualification in physiotherapy. So some of the questions that I get, that if I have done graduation, shall I also mention my master's or MPhil? Yes, you do. Whatever you have done, please mention it. I know it makes your documentation a bit longer, but it is worth it. And as I said, get them all verified and checked by university. Then your proof of practice, for example, verify your professional experience, your employment letter, references, and PEPTA, Regulatory Authority of Pakistan Physical Therapy Association. So make sure you have the membership of PEPTA before you apply, and always mention there is a regulatory authority. I know it's not very active, but we do have a regulatory authority. The membership fee, I think, is somewhere between 2,000 to 5,000 Pakistani rupees. So it's not too bad. You get a certificate, and you also get a letter from them, which is a good standing certificate, or some like a character certificate that you have been good, you don't have any case against you, or you don't have any kind of any malpractice sue or anything like that. So they give you a letter that you have been a good physio, you've been practicing and all, just 2-3 liner, and they give it to you with the certificate. Then proof of proficiency, so such as IELTS, TOEFL, or English proficiency certificate from your university. So IELTS should be 6.5, not minimum 6 in any of the areas. Your TOEFL could be in the middle range, for example, 300 points. And then I say go for the English proficiency certificate, because Guru is accepting that. So if you have done your graduation in English language, that we have all done that, so your university can issue you an English proficiency certificate, and that should be more than enough. Then your identification, a passport, your police clearance certificate. So if you have lived in a country for more than a year, for example, you're born and bred in Pakistan, so of course you will get a certificate from there. But for example, if you're living in any Gulf country or some other country for more than a year, or even in UK you lived in more than a year, you need to get your police clearance from that country as well. Then your completed application form, you submit it, and you fill in, you give your fee, right? So what's next? So we have done everything. The application fee, the application has been submitted, and you get an email back saying that your application is complete, the file is done, and it is going to the next stage, and it is going for the assessment. So when it goes to the assessment team, they might come back to you with some recommendation before they give it to the board for decision. For example, they might come back, look, this letter is not looking suffice, or maybe you're not getting a reply back from them, we cannot do the background check and you see if they're not replying. Or they might come back to you, oh, this document does not look right, or your hours are in this area are not enough, do you have any other area to practice? So they might come back to you. So once you fulfill those recommendations, it will go forward for the decision committee, and the decision committee sits every 6 weeks with hundreds of applications, and they make the decision. So they can come back with 3 possible results, which could be recognition of your qualification, and the application automatically proceeds to your registration. Very good news, well and done, you are Kuru registered. And they will say that you satisfy all the criteria, and you get a letter. Then little bit of sad news, you can come back with the compensation measures, for example, period of adaptation or aptitude test. These are 2 options. Aptitude test is that you will sit in an exam of cardiorespiratory, musculoskeletal, and neuro, either 3 of them, or if they see you have lack in any of the area, they will say, oh, maybe you need to do in this area. Or I don't know anyone who has done the aptitude test. So mostly people go for the period of adaptation. So period of adaptation would be that whatever area they give, they might come back to you. You have 200 or maybe 30 hours less in your cardio. So you may need to go to a cardiorespiratory practice or in an ICU or a cardiac ICU or somewhere, and you come back with the experience. Or any you've seen a patient with asthma, COPD, you did a postural drainage, log it as in your hour that you have done it, so they don't have to come back like this. Go back in your head and write it down and get it proof that you did see this patient. You might have seen, even if a patient comes to you with the MSK, but they have history of asthma or COPD, you will keep that in mind while giving that patient that plan or anything. So log it as well as your cardio or hours, MSK and cardio hours, so they don't come back with this. So make sure your hours are there, so they can come back and you satisfy those measures, and then you go back to them, and then you get your recognition and registration. The third can be a very negative outcome, can be refusal of your recognition. I know it could be very discouraging, but again, there's always a way out. You can apply for appeal, and I know people personally who has done the appeal and it came back with positive results. So to avoid any of these consequences, make sure you have done all that we have just discussed now. Now, this is very optional. You only need ISCP, that is Irish Society of Chartered Physiotherapists. If you're going to work in a private clinic, you can go through this slide in your own time. The information is there. So the question I'm getting, I was seeing that I'm getting this question already a lot, that many people have done their Kuru registration and recognition, but now they're not getting any interviews or they're not getting any jobs. So the job boards are Indeed.ie, irishjobs.ie. There are few things that people don't know. There is a website called PhysioBob as well, where many private clinics post actually. Then personally, I like LinkedIn, which is very good. Make sure your LinkedIn profile is very nicely and professionally updated and you're active there. Then recruiters, there are a few recruiters in Ireland, there are actually many, who deal with the healthcare, for example, TTM, CPL, and there are also some locums, but I'm certain that you can only do locum once you are in the country. They won't sponsor you for visa or anything. And then networking, for example, your Instagram, your Facebook, and again, LinkedIn. But please make sure when you're networking, you are being very professional. Please approach very professionally. Please don't go with the statements like, please give me job, mujhe job de dein. I'm saying in Urdu because these are the exact messages that we get. Okay, like, I have family issues, mujhe ye bahut masla hai, mujhe family ko support karna hai, job de. And even my directors and all those people get the interview, that get the messages like this, which doesn't sound very professional. So please be very professional and avoid any intimidating messages. Why you are not replying? I have sent you email this many weeks, I'm not getting any reply. So these are very intimidating. Please watch your tone. We have amazing platforms now, AI, ChatGPT, where you can even ask to soften your tone if you're writing an email. I know there can be a language barrier as well, a little bit of cultural difference, so you can align your email with AI. So please make sure you do that. Then visa process, you qualify as a physiotherapist, you qualify for a critical skill permit. That is very good visa category. So you are under the critical skill visa, but it helps you to get a job offer easily because they know you are eligible for that. For that purpose, you can apply visa yourself, or you can ask your company or employer to apply for you. There are both options. So ask them if they're going to apply. If they're not, you can do it yourself. It's not a rocket science. You have done a big degree, and that was, you have studied anatomy, biochemistry, and everything. So this is not a rocket science either. It's very simple process. So you just need a letter from your employer that they want to hire you as an employee, and the company's tax registration number. They will give it to you, and you can apply the visa yourself, or ask them if they're going to apply for you. The very last thing I want to share, beware of the scams. Recently, I came to know there are huge scams going on. So they are promising people for the jobs and interviews, and they are taking thousands and thousands of euros. Um, I know it can be very frustrating to come out and practice in other country or coming to abroad. We all been there, but please just don't give away your money and or your parents' money. You can do it all yourself. So be vigilant against individuals or agencies requesting fees for job placements or interviews. Verify job offers and recruitment agency that they're legitimate through independent research to avoid scams. Now, but if somebody, this is the money, if somebody is asking you that you have guaranteed job or a guaranteed interview. But if somebody is charging you for a consultation, for example, they are helping you to, for example, they're consultant in Pakistan as well, who are helping you to prepare for the interview, who are helping you to get through the application. That is different. Okay, so some people came back to me complaining that I'm ruining their business. No, I'm talking different. Somebody who's promising you job or interview and taking money for that, that is wrong. So please be vigilant of that. Thank you so much. I will be open to the questions in the end. Thank you.
Thank you so much, Afifa. Really great talk, very, very comprehensive. और
Thank you.
मुझे लगा कि बहुत important topics इस तरह हैं कि especially अगर कोई undergraduate करने जा रहा है पाकिस्तान में, somebody who's just out of their A levels or FSC, it is so important to know कि आप किस university में जा रहे हैं, whether वो university recognized है कि नहीं, if there's a teaching hospital attached or not. So if you're going to spend 4 or 5 years of your life doing a very important degree, I think it's really important to do your research before that, whether your university is it worth going or not. Secondly, very important message about professionalism. I myself, I'm from a completely different field, but I get so many emails every day from Pakistani people or people around the world who have done no research on who actually they are sending an email to. So I'm a researcher in a specific field, and I get so many emails which are totally irrelevant. And the tone is so casual and they are not professionally written. So I think it's very, very important that when we emails when we are contacting potential employers, we keep our tone so professional. And as you said, there's ChatGPT and so many large language models that can help us with that nowadays to help us bridge that career gap. So again, thank you so much. I hope कि लोगों को फायदा हुआ होगा इससे. As we said repeatedly, the sessions are recorded, so you don't have to worry. Agar kuch miss ho gaya hai, you will have the recording. I'm going to move towards question and answers now. So I'm going to ask the questions which were in the chat box. And the first question is from the first question is, how can a Pakistani trained dentist with BDS degree practice as a dentist in Ireland? I think Dr. Salma आपने सारा अपनी talk में ये बता दिया है. I think this question came in before your talk. So do you want to touch on it, or we can move to the next question?
Well, I just हमारी जो talk थी, it was about how to start working as a dentist in Ireland. So, like many other countries, you go to Australia, America, UK, Ireland. Ireland, again, they have Irish Dental Council exam. You have to do both parts, part 1, 2 attempts once a year, part 2, 3 attempts once a year, 1 week long exam each. You have to pass both of the exams in order to be on the register of Ireland Dental Council, Irish Dental Council, and then you can start. I'm like practicing as a dentist privately or HSC. It all doors are open. There are many jobs.
Yeah. Okay. Thank you. And there's another question for you, Dr. Salma. It's from Shoaib Arshad. He's from Doha, Qatar, and he's asking. He's in the reserve list for Irish Dental Council exam for this year. And he would be grateful if somebody can guide him for the exam. And then he has also cleared MFD, MFDS, and got admission in Masters of Surgery program and RCSI. I need guidance for any job opportunity during this 1-year study program. So do you have any tips for that?
And I just need to ask Mr. Shoaib that if he is on the waiting list, he must have passed the part 1. That's my main question. Yes, part 2 is going to be held in June and July. And yes, he can. I don't know. I get this question quite a lot of time. If we can get temporary registration with the Irish Dental Council, I don't know anyone, but yes, with the master's degree probably that he is holding with MFD and MFDS, no, he cannot work as a dentist, but he may get into the hospital practice in a maxillofacial department. I know of nobody. I know of no one, but he can try getting through that route. But the best would be if he has done MFD, MFDS. That MFD, MFDS also prepares him for the council exam. Basically, I always advise all the students, कुछ ना कुछ करते रहें, पढ़ते रहें. That always prepare you for your upcoming exams. He can, as I said, कि मुझे नहीं पता कि he has already done part 1 and bench test. If he has done that, part 2 is only a month away. I wish him best of luck. And yes, he definitely can.
Okay, thank you so much. Another question for you, Dr. Salma. Is there any specific pathway for specialist? I'm an orthodontist, and this is Shayan Beg.
All right. Orthodontist, yes, there is. They can, there's an exam called MOrth. They
Okay.
have to do that exam, and once they have done that exam, they can get themselves registered. But having said that, I know orthodontists, they had to go through the council exam as well. Now that
Okay.
need to be clarified with the Irish Dental Council. My best advice would be drop an email to Irish Dental Council with all your credentials and have a look. If they need some other documentation, or if they need to make you sit the council exam, you have to do it. But I know maxillofacial surgeons who are consultant, they have to go through the same exam, the council exam, to actually get the license, and then they could. But I think there is an alternative pathway that they could try. Definitely. What I would do, I'll email Dental Council to the registrar straight away.
Okay.
That you are, and once he has done MOrth, yes, there's a possibility.
Okay, but doing MOrth also needs you to pass the bench test, part 1 and part 2.
That needs to be clarified.
Okay.
I'm not 100%
Yeah,
sure,
okay.
but I know of the fact that people who have done even MOrth, I know
Yeah.
so many working with me in the same organization, they had to go through the council exam.
Okay.
But there is a chance that they did MOrth after doing the license exam, then they became on specialist list register. So that, I would ask Shayan to, the first thing he should do, email Dental Council and also apply for the MOrth exam. There are MOrth academies in Scotland. Dr.
Okay.
Mo Al-Musian, he runs that. I am not promoting anybody, but that's one of the best ones that many Pakistani people who have done MOrth through them, he can get that done and get it off his way.
Okay, that's a really great and important tip. Next question for Gul. How many attempts to pass both exams, the one for UCC and RCSI? Gul, do you have any insights into that?
Yeah, so the equivalence exam, the first one, the stage 2, that's only one attempt. Like, it's when you're applying for your registration and you get your documents verified, the equivalence exam is a part of that as well. So it's like one attempt for that stage 2 exam. If you pass, you pass. If you fail, then you have to reapply again for the same process and pay the fee again.
Okay.
For the stage 4, which is a pre-reg exam, which is conducted by RCSI. They're like twice a year exam, as I said, in May and in November, October, November. You can do the both sittings, and also the process has to be completed in 3 years. So you can say there are 6 attempts for the pre-reg exams.
6 attempts.
Yeah.
So unlike dentistry, I think dentistry has very limited attempts. So you can do it repeatedly, but you'll have to pay the fee over and over again if you fail that.
Yeah,
That's
like the
right?
first step, for the first step, they have to, like, the first exam, when you pay 1,500 euros, the equivalence exam is once off, and you have to
Okay.
pass it. If you fail, then you have to do that again. But the fourth
Okay.
step, when there is a second exam, the final ones, they have 6 attempts for that. Like, they have to do 6 in 3 years' time. Either they do
Within
once
3
a
years.
year, maximum 6
Okay.
attempts. Yeah.
So you have to do that within 3
3
years,
years
and then
time.
there's
Right.
2 attempts every year. Okay,
Yeah.
that's very clear. Thank you so much. Resources for pharmacy exams, are they doable easily? I think that's a very broad question, but if you can briefly touch on that, कि कहाँ से तैयारी करनी है, किधर से देख के, books and all that.
तो बुक्स का मोस्टली ये होता है कि जब इक्विवेलेंस एग्जाम्स के लिए वो आपको ईमेल करते हैं, दे आल्सो गिव यू अ सैंपल पास पेपर्स और रिसोर्सेज की भी लिस्ट आपको मतलब साथ बता देते हैं कि इन बुक्स से स्टडी किया जा सकता है, बट इट्स लाइक 20 बुक्स जो वो रिकमेंड करते हैं, एंड इट्स नॉट दैट इजी टू स्टडी ऑल दैट 20 बुक्स मतलब सिर्फ एक एग्जाम के लिए. मैंने जो पढ़ा था, I had a very limited time, so I studied from there is a book called Comprehensive Pharmacy Review. It's for Netflix, it's for American test, लेकिन it's a very big book. उसमें से मैंने मतलब I go through that book, और मैंने newly qualify किया हुआ था. I qualified in 2014 and I applied for in 2017. तो इतना फ्रेश था मेरे माइंड में, इट वाजंट दैट डिफिकल्ट. मैंने वो बुक पढ़ी थी पहले to revise my concept, और उसके बाद there are books where you can practice for MCQs. They're like fast track books for pharmacy. They're like MCQ books. उसमें आप MCQs को practice. There are 3 or 4 or 5. It's like by subject MCQ books हैं, तो वो buy कर लें. They are also available online. वहाँ से PDF डाउनलोड करके भी they can practice, और MCQs की practice वहाँ से की जा सकती है. For the OSCE part, there is a book called Community Pharmacy, and the book is Paul Rutter. वो बहुत अच्छी बुक है because it's more Irish based के Irish pharmacy के अंदर people how they come and for like how they ask the questions. तो आप OSCE के लिए वहाँ से study किया जा सकता है. And there is another book called Pharmacy OSCE, a revision guide. It's a small red book. इसके अंदर बहुत अच्छे scenarios दिए हुए हैं, and also they can read the scenarios, practice the scenarios, and the question they can ask in the OSCEs. तो यहाँ पे live and inactive दोनों के लिए तैयारी की जा सकती है. Plus I studies from YouTube as well, क्योंकि हमारे OSCE का है नहीं पाकिस्तान के अंदर, ये OSCE होता नहीं है, तो they can just watch the videos. Like you have to really see the body language, the question, how the examiner is going to ask. तो ये सारा कुछ आप वहाँ से देख सकते हैं to get an idea कि exam कैसा हो सकता है. Or yeah, the main part is the calculation. We don't study actually in Pakistan. Nobody focus on the calculation part. Like in यहाँ पे it's very very important. तो calculation के लिए there is a book called Judith Aris हमारे होते हैं Introduction to Pharmacy Calculation. I practiced that book twice. Like 2 दफा मैंने सारा question by question मैंने वो book की थी. And then like its calculation is in first exam, then second exam in OSCEs and everyone. So you have to be very good in calculations to pass the exams like MCQs and OSCE as well. So ये resources जो मैंने 2017 में use किए थे. Maybe there is another updated list the PSI will provide once they pass the verification process. So
well, that's a lot of study, but I hope कि सब अपने notes ले रहे हैं. अगर notes नहीं भी लिए तो please don't worry, the session is recorded and you can have access to it later on. So again, next question is by Osama Khan, what is the cost of entire process? I think you spoke about the fee of exams, but if you can repeat that for Osama.
The total fee which I paid in 2019, like for all the stages, it was around 3,500 euros. लेकिन अब ये ज़्यादा हो चुकी हुई है. I think it's around 5 grand now for all four. For
that's
all
just 5,000 euros.
5,000 euros
for all of them, for all the 3 exams. 3 exams, right?
Like 4 steps. Exams. 4 steps. It's 4 also steps. On their updated.
But you don't have to pay 5,000 upfront, so it can be broken down.
Pehle, first process they have to pay 1,500 euros exam ke liye. Then sorry.
I don't know, I think.
Adike, I've sent to everyone, na re. Dalan de the end ki.
Okay. Sorry about that. I think किसी का mic unmute हो गया था.
Okay.
Anyway. Acha, so we were there. Next question is, what's the ratio? Sumaira is asking, what's the ratio of passing exams? Do you know that? Sorry, Gul, you are on mute. Yeah.
For dentistry, I can tell.
Yeah. Or the ratio for passing equivalence exam is not bad. Like a lot of people pass it. Like if you study properly, it's all about studying the like MCQs or OSCE को अच्छे से कर ले. They know that you're coming from a different background, तो थोड़ा सा easy रखते हैं वो. But it's like when I applied, we were 12 international students. and I think only 6 of them passed, and I was one of them. So
Okay. So it's around 50% at that time.
around 50%, you can say, yeah.
Yeah. Okay. Back to Dr. Salma. So I think Afifa, आपके questions आखिर में आएंगे because your talk was at the end, but we'll go there as well. So back to Dr. Salma. I'm a dentist, graduated from Pakistan, have 4 years structured training in oral and maxillofacial surgery, MDS from Pakistan, and 1 year experience in pediatrics and maxillofacial surgery. I'm currently in Ireland on spouse visa. I want to know what option I have here to pursue my career. Again, I think that your whole talk was about how to pursue career, and it's a good thing that if you're already in Ireland. So, Dr. Salma, maybe if you want to briefly
Yes,
address that.
exactly. She has look the Irish exam quota, 80% quota is for those who are actually residing in Ireland. So the best I would do is just apply to the Irish Dental Council exam and actually start preparing for part 1. Unfortunately, our training from Pakistan, be it maxillofacial surgery or anything orthodontics or prosthodontics, that's not recognized. They won't take you on specialist list. They have anyone who has done that. I repeatedly say that they have to go through the license exam. If she is residing here in Ireland, what I did, I came to this country with 3 months old baby girl, and it was tough. I knew nobody. I had no access. They can, once she gets the registration for the exam to sit, she can have an access to 3 years past paper. Then she will get to know people. There are lots of WhatsApp groups. I know so many Pakistani and mostly Indian and Brazilian graduates. They work with us as a dental nurse. Unfortunately, mostly Pakistani, when they contact me and I ask them, oh, अब मैं as a nurse काम करूंगी, it's hard, but that's the best way to actually start your career as a dentist, because I didn't learn working with Dr. Mustafa, Dr. Hamda, Dr. Afifa. I did my exam and I started my own the way I've been working as a dentist. It's always good to watch. It's always good to see. You learn a lot. I see the fresh graduates who are working with us in the corporate in one clinic or another clinic, and they do their exam, they move on, they start working as a dentist. So that's the best advice that I would give to any dentist who is residing. I got another question as well, probably. That some girl is asking that she has moved to Ireland on a spouse visa. Again, is a plus point. She falls in the category of 80%. She will get, exactly, she will get accepted. Now, the requirement that she needs, obviously, she probably has done only house job or maybe a 5 months experience. She doesn't fulfill that criteria. Again, I would suggest and advise to get into any dental clinic, work as a dental nurse. Either me or anyone will give you experience certificate, and then you are all eligible to sit the Irish Dental Council exam.
I think it's a great way to put your foot in the door as well. So if you know you start working in a clinic, you're surrounded by people who have gone through the same process. You learn from them, you learn from experience, and then it would be easier sitting the exams and clearing them.
Exactly.
Yeah, well, that's a great tip. So, okay. And then there's someone who's asking if there's a possibility for an undergraduate, like a 3rd-year BDS student, to come in Ireland for training. I think you have already clarified that we need 1 year house job and a few years experience from Pakistan.
If they look, even again, as Afifa mentioned, and also Gul, even the BDS from Pakistan needs to be from recognized institution. Otherwise, they won't be able to sit the exam. There are so many private colleges they have started. If they are not recognized, I don't think so that they will actually make their way to sit the exam. So he or a 3rd-year student, 4th-year student, no, they have to have the graduation done. They have to have internship or house job done. It's equivalent to 5 years dentistry course here in Republic of Ireland. Whereas we do 4 years BDS course and then followed by a 1 year house job. But then again, as I said, it has to be 3 years post-grad experience in order to be eligible to sit the exam.
Okay. And Sayyida Fatma Tazara is asking, does the nursing experience count as the required experience to be eligible if someone is staying in here since they're postgraduate? So अगर किसी के पास, for example, 3 year experience नहीं है पाकिस्तान से, but if they have a 3-year experience as a dental nurse in Ireland, would that count?
Absolutely, yes. And that's what I've been telling.
That's really good, yeah.
जिनके पास जिन्होंने पीछे से हाउस जॉब कर रखी है, I know even somebody who has done actually graduation, but that's from another country. I don't know if that's a different, क्योंकि इन लोगों ने भी डॉक्यूमेंट्स देखने होते हैं. लेकिन yes, अगर उनके पास 3 years की पोस्ट ग्रेड एक्सपीरियंस नहीं है, यहाँ का जो एक्सपीरियंस है in a dental clinic, the good thing about Ireland is, let me explain one more thing which will be very good for audience. Irish Dental Council आपको आपसे एज अ डेंटल नर्स काम करने के लिए रजिस्ट्रेशन नहीं मांगता. सो आपकी जो क्वालिफिकेशन है, दैट actually allows you to work as a dental nurse. Yes, of course, you are trained by the practice manager and by other nurses, but that's a good thing. You can actually finance and sponsor your masters or whatever you're doing, and you can pay for the courses, and at the same time you're learning actually. So anyone who doesn't have an experience from Pakistan, they can actually get into a nursing job. The good thing is that they may actually, because UK has started, in UK you can't work as a dental nurse. You have to be registered on the General Dental Council. But Ireland is a bit, I would say it's an easy pathway. They should just avail it. Yes, they cannot work as a hygienist. They cannot go near the patient, but they can definitely work as an assistant.
Assistants, okay. Yeah. And the next question is for Afifa. Afifa, I'm a physical therapist with Koru registration and ISCP membership. I've been applying for jobs in Ireland, but haven't been able to secure one. Could you please kindly guide me with some tips on how to? I think you already mentioned a lot of resources on how to get jobs, but if you want to add anything here to improve.
Yeah, your CV matters a lot. Thank you for this question. Your CV is the first picture that they're going to get. So the picture of the CV. And also one thing I see when we receive the CVs from Pakistan, people have their picture on the CV. You don't need to put your picture. More like selfie, we don't need to see the picture. Just your professional CV, one or maybe 1 or 2 pages, nothing like that. And avoid making it on different templates. I know there are many different fancy templates in Pakistan to make the CV. Just avoid that. A plain, simple CV is more than enough.
Length kitni honi chahiye CV ki? What do you think? Like
1.5 page or maximum 2 pages is more than enough. I know because for physios, thoda sa ye hota hai ki we have the clinical experience, so वो 1 by 1 जाना होता है. तो please put everything there, और हर clinical experience को थोड़ा सा बहुत 2-3 line में elaborate करें and make a very nice cover letter that gives you a personal touch. I know people use AI, but वो थोड़ा सा robotic language होती है. Give it a personal touch. That's why I want to do it. Irish are very friendly. They appreciate the talk which comes from heart, which connects them. When I got the first job, when I asked the person why among all these people you gave me the job, she said, I like the honesty and the personal vibe you were giving. So these things matter. Even like nice, if you get to the interview phase, a nice smile on your face matters as well. How you come across as a person, because we don't forget, we are bridging a gap of 2 cultures. So they need to see a very beautiful and very soft side of you, okay? And make your CV very professional. Highlight your clinical experience first and education later. So go from we all know, your recent experience first and the first one later. So these basic things. And make sure you're using the terms which are globally recognized. For example, कुछ टर्म्स पाकिस्तान में भी फिजियोथेरेपी में ऐसे यूज होती हैं जो शायद अभी आयरलैंड में नहीं यूज होती. They don't really care about that. We want to see your clinical expertise. People here, they don't want to see your thesis, masters. We want to see your clinical skills. That's it.
Okay. I think, or I would also like to add कि CVs को to tailor about a specific job. So जहाँ जिस job में apply कर रहे हैं आपकी CV जो है वो tailored होनी चाहिए to that job. And then there are lots of resources on YouTube on how to give interviews, how to prepare for interviews. So prepare well before applying.
And for example, if you go to the job description is asking you for a nursing home or geriatric experience. So maybe align your CV according to the patients that you have seen in geriatric experience. Or you're applying to a pediatric setup. Make sure or if it's a community setup, make sure your CV aligns with that. It's not lying. It's you must have seen those patients at some point in your life, so align your CV according to that. Maybe exaggerate it a little bit, right? But
Yeah, and
don't lie.
highlight the relevant experience
Highlight,
more.
yeah, but don't lie. Yeah,
I think, and that is across every field. Suppose not
every
just
field.
physiotherapy, but हर field में
Yeah.
यही rules apply होते हैं. Next question. Thank you, FIFA. Next question is for Gul. Sumaira Mushtaq is asking, you're sharing that clinical experience is must, but anyone who has completed 5 years of pharmacy and after that join university as a lecturer with no clinical experience, what do you suggest for those people? I think, well, you mentioned that there's no experience required for pharmacy.
Yeah, there is no experience, like it's clinical experience during like when they're making the application, when you're applying for an island in Ireland, then you have to show your clinical experience, which is your internship. That's also called like house job. सिर्फ वो clinical experience you need to show it in your documents that you have done your internship or house job during when you were studying. After that there is no need for any clinical experience. जो आप registration यहाँ कर रहे हैं और adaptation ये that is your you learn about clinical setup over here. उनको PSI को या job को उनको कोई फर्क नहीं पड़ता कि आपका clinical experience है पाकिस्तान में या नहीं है. वो यहाँ पर जब आपको job मिलेगी आप किसी भी सेक्टर में कर सकते हैं. बट इफ यू डोंट वांट टू गो टू अ क्लिनिकल सेटअप, देयर इज यू कैन गो टू एन इंडस्ट्री देन. If you are a lecturer, you can go, and there are also lecturer jobs. मुझे इतना idea नहीं है उसका, but I recently there is a friend of mine. She is applying online. She hasn't got any job yet, but like yes, you can apply as a registrar, lecturer over here, and also can teach in um, training college, like pharmacy training college in Ireland as well.
Okay.
So yeah,
that's good. Thank you. And the next question is, which academy did you get your PSA exam preparation done, or any other resources? Kindly please mention. So PSA की exam preparation कहाँ से की थी? I think you mentioned all the
yeah, I
books
did
that
it myself. There's no academy, so don't waste your money. There is no academy and nobody gets you prepared for it. जैसे मैंने कहा कि जब second आपका step होता है, जब second stage आती है, जब equivalence exam आते हैं, they provide you with one sample past paper or also a list of books you need to study from. बस वही आपको उधर से ही prepare करना है for your exams, and also you can find some of the past papers online. Like मैंने सिर्फ Ireland के past papers नहीं किया था because the pharmacy same all over the world. तो आप you can just do like down OSCE exam past papers or MCQ past papers online of any universities और उनको practice करें. The more you practice, the more you will be able to pass the exam. So there's no academy. You have to do it. Basically, you have to do it yourself.
Okay. Thank you for that. And I think for Dr. Salma, I was selected as a dental surgeon, but I have to sit in the exam. Any routes for temporary license? I think Dr. Salma, you have touched on that quite a few times now. That there's, if I'm right,
there's no.
Okay.
I don't know of anybody who has got a temporary registration, and then in UK, I know there's a way to get a temporary registration with the General Dental Council, but I haven't heard of anybody. Yes, there could be. The best way is to email Irish Dental Council and put your query on if they give you a registration, and then you can go through. Or I'm like, it is more easier to contact the council. Yeah.
Okay. And I think the other question from Sharaf Inayat is, any exemption from Ireland's statutory examination for Pakistani dentists? I think you have mentioned that repeatedly, that there's none.
Previously, ages ago, I don't know how many years ago, I did my both part 1 and part 2. But I think many years ago, there used to be an exemption from part 1 theory part for those people who had master's degree or who had membership exam, Royal College of Surgeons Ireland or Royal College of Surgeons England or Scotland. But they still had to do the bench test, which is actually the key part of the part 1. It's the practical exam that they will assess the candidate, that how much capable this student is to work as a doctor, to prepare the cavity or access the root canal or prepare a crown on mannequin head. And each part of that exam, which is an hour and a half, has points. So there's no way that you'll just fail. They will actually tell you with the feedback.
Okay.
I think the exam needs to be done now. No one can get an exemption on
And
the
no
basis
good.
MFT or
Okay.
MSc or MDS. They have to sit both parts, and they
Okay.
have to pass the full part one in order to sit the part two.
So there's absolutely no escape from
There's no
the
escape.
exam.
No, they have to.
Okay.
And
Yeah.
you know what?
They
I
have
do
to.
understand that they have to deal with patients independently. There are
Yeah.
so many things that may happen in the dental clinic. So before even I would talk maybe some other time about that, they have
Yeah.
to have the basic life support course, and that's valid only for
Okay.
years, and all those things. And they have to have professional indemnity, obviously.
Okay.
Yeah,
Okay. Thank you for that.
no
And
problem.
Yusra is asking if there's any help regarding bench tests. It's the toughest to crack. So there are any courses, any academies, anything
That's
that
what
you
I
can mention?
mentioned. Yes.
Okay.
By the time when I did my exam, there was no course, but now because of the high demand, Royal College of Surgeons, they run a course. The cost is 2,000 euros and it prepares you for the bench test. And yes, people do it and they benefit from it.
Yeah. Okay. Okay. That's good. And Anam Inam is asking if you don't have any clinical experience, just house job and 10 years of fast, are there any master's degrees you can do in Ireland, or can you do training? Yeah.
If look,
Again, I think, yeah.
yeah, masters. If she has done graduation from back home and it's recognized university, and she has done a house job, and what I'm getting is there's a 10 years of gap. That's what she's saying.
There's 10 years of gap between house job and her current status. Yeah.
Yes, the best thing would be that the past 3 years should be working. So in order to sit
Yeah.
the exam of Irish Dental
Yeah.
Council, she needs to get into some experience that could be in the dental clinic. Why I mentioned dental clinic, because that's what dental council is gonna accept. Otherwise,
Okay.
she could work in what this insurance companies or the VHI or a lot of dentists who couldn't pass the exams. They actually diverted their ways and they work for all those Dental Care Ireland, VHI dental insurance, because they know the basics, but they couldn't
Okay.
get the license. They have to work somewhere. That's
Work
what they
somewhere.
do.
Okay.
It's just an idea if someone, but the other thing is that for this girl, I forgot the name. I'm so sorry.
Anam.
Anam. Yeah, Anam could, I'm like, I don't know how much she's interested, how much you are interested in teaching side. I know a very good friend of mine. I'm not sure, she probably is not in the webinar today. She did an exam a year ahead of me, Dr. Mutahar alone. She did the license exam, and after that, she found herself that she is not enjoying the clinical side. What she did was she did dental public health masters, then she did a masters in anatomy, and then she did PhD in anatomy, and now she is a senior lecturer in Cork University Hospital teaching MBBS students as well as dental students.
Oh, that's amazing. That's
Yeah,
amazing. So
so
there's
there is
this research and academic route as well there. So
yes. So she just said, Salma, I don't think so. I'm fit for clinical work, and that's
okay.
the route that she has, mashallah, 3 boys, and she said that I enjoy the teaching part. So yes, that's one thing that people like Anam, they can think over. But then again, if she really wants to get into clinical, the best thing is get somewhere as a nurse,
Nurse.
apply for the exam.
Okay.
You're already residing here, better chances to get accepted for the quota
Yeah.
for exam. Do your part one, give full go. We are here to help. Yeah, just work with
Yeah.
us as dentists. Why not?
Yeah, thank you so much. I think it's really important that you can work as dental nurse and then start preparing for exams. So मैं सबको ये remind करना चाहूँ कि मैं I'm going through the questions. So जो पहले questions आए हैं मैं वो पहले पूछ रही हूँ, बाद में जो आएंगे तो wait करें please. We are going to address most of the questions. We'll try our best. I think the next question is again for Gul. Is there anybody from the panel who can guide us for finding a job in pharmaceutical industry? I don't know, Gul, if that doesn't if it doesn't come, if it's not in the scope of this talk, you can
No, I honestly I don't have much experience about industry pharmacy. Yeah, they can find like their like websites where they can find the job for industry. Like in मेरा ज़्यादा clinical experience है, so I can't
Okay.
really comment on that. Indeed, pharmacy jobs that it's irishjobs.ie. They can find like a job like over there, but sorry, I can't much
Okay,
tell
no,
about
that's fine. That's fine. Yeah, because it's a sort of a different field, so it's not
yeah,
clinical pharmacy.
industry.
So
Yeah.
I understand that. Hafsa is asking, please guide us about new holistic assessment process. Does that exempt us from exam and adaptation period? Again, if you have the answer, I don't know if it's a recent
Yes.
change or if
It's a recent change, but like as I said, it's all depend on how you perform in your equivalence exam and also your documentation. लेकिन exam step 2 से exempt नहीं हो सकते. You have to do the equivalent exam and adaptation period भी होगा because you're coming from a different country. You don't know about the process and the system in Ireland. So अब बेशक आपका बहुत अच्छा clinical experience क्यों ना हो पाकिस्तान में, you still have to do the adaptation here to know that यहाँ पे basically pharmacist जो है वो individually you can say the pharmacist is the boss of the pharmacy. तो आपको सब कुछ आना चाहिए. Everybody comes to you for the queries and questions and everything, and it's a finally you have to sign off everything. So they make
Okay.
sure when you are independently in the pharmacy, you know everything about how to operate a pharmacy. तो उसके लिए adaptation period होना must है ताकि आपको कोई ट्यूटर फार्मासिस्ट जो है वो प्रॉपर्ली शेडो करे, आपको लॉज समझाए, सिस्टम समझाए, स्कीम समझाए, हाउ अ फार्मेसी इज रन आउट. सो एडेप्टेशन कैन नॉट बी एग्जाम्ड, ऑल्दो ड्यूरेशन आपके क्लिनिकल एक्सपीरियंस की वजह से कम हो सकता है. मिनिमम कुड बी 6 months, मैक्सिमम इज 3 years, और ये पीएसआई डिसाइड करती है ऑन व्हाट बेसिस दे आर गोइंग टू गिव यू द एडेप्टेशन पीरियड, ड्यूरेशन ऑफ द एडेप्टेशन पीरियड. तो
Okay. No, thank you so much for a very comprehensive answer. Okay, so for a FIFA, suggest a good hospital to apply for physiotherapist in Ireland.
As I said, there is a huge scope of physiotherapy in Ireland. There are many hospitals. You can apply through HSE as well, that is public hospitals, but they are currently not doing many sponsored visas. So I say the route would be just apply through private hospitals or clinic or nursing home. Nursing home are in dire need of physios because of the age is because of the good healthcare, the age expectancy is high in Ireland. So hence there are more nursing home, hence we need more physios for geriatric population. That would be a good one. But I find it's very challenging for the people who are coming from Pakistan because there is no such concept of many modalities that we use in Ireland. For example, hoist or Sarah study and these type of things that we use, but you can always get training for that, and always make sure when you're doing the interview for that you say that I'm open to learning, I'm open to training. As I was saying earlier, we people are looking for the people who are willing to learn, who are willing to practice. Okay, so you don't have to come 100%. So I was also getting this question a lot, that how I make it sure that I have certain hours. If you have done your 5 years of degree and you have completed your clinical hours within that degree, that is more than enough. You don't need any extra for that. You don't need any masters. Yeah, if you want to do it, I have done it myself. But if you want to do masters to secure a job, no, I think you don't need that. But if you want to do masters to make your skills better, yeah, why not? But I'd say that focus more on, if you want to practice as a physio in a clinic or a hospital, focus more on clinical skills than the masters or PhD. And yeah, that's it. And for hospital wise, there are many hospitals. I mean, there's Hermitage, there are private clinics, there's Beacon Hospital, there are local hospitals which are under HSE, for example, St. Luke's in Kilkenny, Naas General in Kildare. But always there is a separate quota for that. So if you go to HSE career websites, the jobs are open there. So you interview for them, and you can start interviewing for them when you are in the process for Kuru. You don't have to have a Kuru. Yeah, the chances are you will get the interview if you have the Kuru, but you can still start interviewing. And so yeah, you can go to HSC Career website as well. You can go to TTM CPL website. So they are the boards which have all the jobs in the hospitals who are looking right now. So you don't have to go to
Okay.
individual hospitals. I
Okay.
hope that
Okay.
answers the questions.
No, that's a very good answer. And then I think the next question by Ushna, you have already covered that now in this answer. Which pathway is preferable for physiotherapist for either Koru registration or enrolling in an MS program? I think you have just said that if you want to work, then MS is good for building up the skills.
I
But
mean,
for
who wants to pay 20,000 euro for masters when you can start
yeah,
earning? I think if you want to practice, if you have spent enough on your DPT, I think it's very, very expensive degree, then
yeah,
I'd say just spend half of the money on getting some clinical skill. Maybe get your hands
clinical
on
skills.
some other
Okay.
clinical skill rather than investing in a master's program that is doing the same job as your DPT. And your DPT is your master's, basically. It's a 5 years degree. So you don't need that.
Yeah. Okay. Afifa, the next question is also for you. Mevish Pasha is asking, my cousin was recently got a deficiency in cardiopulmonary and she's interested in pursuing POA in cardiopulmonary. However,
Mhm.
she's currently in Qatar and don't know which universities offer this program. I don't know if you'll be able to help with something. Okay.
Okay, so I want to clarify that POE, for everyone who just joined, POE is period of adaptation in Ireland. So, as I said in the slides as well, they can come back to you with the specific area or they can come back to you with all the areas. For cardiopulmonary, which covers your asthma, COPD, post cardiac surgery, bypass, all these patients. For example, you're helping to rehabilitate anyone who just had the surgery of their under the cardiothoracic surgeon, that comes in that domain as well. Anyone who's coming to you with the postural drainage or anyone who's coming to you with a sputum or phlegm problem, that comes under this domain. So if she's struggling with that, she can, if she is, I believe if she is in Gulf, she must be practicing. If she is practicing, she can go to any clinic or within the area she's practicing and ask them that I need these hours. If you have few patients of these available, can you give me a certificate of that? I will practice that. And just work on that, and also do some online research and do some online courses. And maybe even if you read journals on cardiopulmonary, that will contribute it as well. Just get it tested
Okay.
and read materials on the cardiopulmonary and just get a certificate of the course and give it to them if they have objected on the theory side. If not theory side, if it's only the practical side, go in the hospitals and the private clinics, tell them you're happy to do it voluntarily. You don't need, I can do 3 hours per week and within 2 months you will be done. That's what I did because I was studying for 2 years between 2016 to 18. I was continuously studying, so I had a practice lag of 2 years. To cover that, I had to do 210 hours and I was done with them in a month. And after that, straight away, after
Okay.
1 week, I got my registration. So you just need to, even if a person who is in Ireland, I know moms who come to us all the time that they want to go back to the field, even they are Irish or British, whatever. We supervise them because they had a practice lag of 10 years, 5 years, 2 years, and that is fine. As a woman or a man as well, we might need to go on maternity break, and that can extend to 2 years. You can always cover that gap by practicing it. And you just need to practice under a person who is Kuru recognized in Ireland. I don't know
Okay.
how it works in Ireland, but I've come to know that they have asked them as well to practice under a Kuru registered physio who has experience of more than 3 years. So that is why it's very important when you are filling your application, please calculate your hours properly.
Okay, no, that's very important. I'm going to now skim through the questions. We have a lot of questions, and the time is we are already out of time, but we'll go through some that are coming over and over again. Yeah, very important for Gul. The practice that has to be done under supervision. I think that's the adaptation period. Is it paid or unpaid?
Yeah.
Uh,
You can go in the clinic and then ask them. It should be maybe 1 week, 2 week, and they should be happy to give you. You're giving your services for
Okay.
free. It should be okay.
Okay. And what
Okay.
about pharmacy, Gul? Is the adaptation period, is it paid or unpaid?
They say on the website it's paid, but it's hard to find the like a paid one. With the third country pharmacists are not considered as Irish pharmacists, so you don't go through a
Okay.
panel. So they have to find, like, it's like a finding a job, a training for yourself. Sometimes the
Okay.
pharmacists say, oh no, we can't pay you, like we don't have the resources and all, like, so sometimes it's paid. But what I did was like I started working as over-the-counter assistants, like it's on the front on the counter. While I was doing this process, when I was doing the training, I was working as OTC. And then like when I was a little bit experienced, I started working as a technician. When I kind of knew the pharmacy, I started working as a technician. So if your internship is not paid, don't worry about it. Find a job as an over-the-counter assistant or pharmacy technician, and you can just work as a technician or OTC. And in the meantime, you can get through that process. And when you're a pharmacist, you can straight away. And it also counts as your clinic, not the clinical experience, but they see that you have worked in a pharmacy. So it's also good, like if you work under those titles.
Okay. That's
Yeah.
very good. Thank you. I want to ask for pharmacists, those who are in Ireland also have 80% quota like dentist. I think no.
No, I
Like the
have
dentists
not
have
heard of.
no. Okay.
No.
Yeah, okay. Physiotherapy, since sponsorships and work permits are currently not offered for international applicants, would pursuing a master degrees would be again. I think we keep coming back.
It's the same
FIFA
question.
on masters versus degree.
I think we had a huge influx of physios last year, so it's a little bit slower now. But be patient and keep applying the jobs. Make sure your CV stand out. You will get a job. I know a few people who are in the process of job hunt and they are getting interviews. So make sure your CV is standing out and you prepare for the physios. You will get. Don't fall for any trap. Again, I know it's frustrating, but again, be patient. You will get it.
हाँ I think hiring process जो है ना वो cycles भी होती है उनकी एकदम like lots of job offers फिर वो थोड़ी सी field जो है वो saturate हो जाती है फिर थोड़े से में दोबारा से jobs
It's up and down.
so
It's up and down. And trust me,
It's up
even
and down.
there was a question, Hamda, that the Kuru process is very slow. Yes, it is very slow. It can take from 8 to 18 months. But the reason is they are not only doing it for Pakistani physios, they're also doing it for the physios who are graduated in Ireland. So even the Irish who are graduated here, they also have to go do the Kuru. And from
Okay.
UK. So it is slow, but it is worth it. And now they are doing meeting every 6 weeks. So it's getting
Okay.
better. So just be patient. It can take 2 years as well, but you will get it. It's
Okay.
worth it.
Okay, you will get it and it's worth it. Very important messages. For Gul, the PSI asks for 6 months of clinical internship. If someone doesn't have 6 months of clinical internship only in hospital, but in other areas of pharmaceutical practice, makes a complete 6 month, would it be considered? I think the question is a bit vague here, but maybe you can.
Sorry, what's the question again?
Yeah, so if someone doesn't have a complete 6 months of clinical internship only in hospital, but in other areas of pharmaceutical practices makes a complete 6 month, would it be considered? So I think a hospital may clinical experience nahi hai, but in other areas hai, so would that be considered or not?
No, it has to be a patient-facing experience,
Patient-facing.
either in a hospital or in a community. Yeah, like if somebody is from industry or somewhere else, it is not considered as a clinical experience. It has to be a patient-facing setting, a community or a hospital pharmacy.
Okay. I think Dr. Salma, again, where to study from law and ethics?
Yes, a good question. Everything about law and ethics are available on the Irish Dental Council website. They can go through it. They'll find each and everything.
Okay, so it's there on the website.
It's there on
For
the
Afifa, thank you so much. I am a fresh DPT graduate from Pakistan and currently doing my master's program from Paris, and I have not done house job or have no such clinical experience after my graduation. So what are the chances for me to get a job after Coro registration? So I think the first step would be to get Coro registration, wouldn't it?
Yeah. So the first process is again Kuru recognition and registration, and I suppose the master's in Paris is only 1 year. So you do not have a gap of more than 2 years. So I will suggest start your Kuru now before your gap becomes 2 years, because I was doing my master's as well and they still considered it as a gap because I think there is no clinical placement in your master's. Is there? Please confirm me. But if there is no clinical placement, then they will consider it as a gap of 1 year. But again, it should not matter because it's a 1 year gap. But if it is a more than a gap of 1 year, then you will need to do your clinical placements. But if no, your degree that you have done, your DPT, that is enough. Those hours, 910 to 1600 hours, are more than enough to get your Kuru. As I said, Kuru is not for someone who only wants to do job from Pakistan to here. Even the students who are studying here after their 4-year degree, they have to get Kuru registration, and straight when they are out from college, they have to do it. So if a 4-year degree holder can do it, you have 5-year degree, you can do it as well. So you don't need any after job or after internship experience. Within that 5-year domain, whatever you have done, it is enough to practice.
Okay, thank you so much. And the very last question, we are going to close this after this. Thank you everyone for amazing questions. Our chat box is full. And I hope we have tried to address everything. A class question है for a FIFA. I'm a Kuru registered physiotherapist. How can I apply for paid internship? But I think we are talking about jobs here. So is there any way to get internship? So do they need to
If
get
you're already in
internship?
Ireland, if you are already in Ireland, you can go to nursing homes. If there's any physio working there, you can go to private clinics, knock on the door and pop in. There is no harm in
Okay.
that. Drop your CVs and ask them, look, because students come to us all the time. As I said, that all the graduates are looking for clinical experience. So all the clinics have student mentorship program. I mentored the students myself as well. So they come here because they all have to do 6 weeks in MSK, 6 weeks in Euro. They all have to do that. It's a part of the program there. So we mentor the students all the time. They should be happy to take you because we get a lot of work done as well. We are looking when the students are coming because we're asking them, are we having any students? Because it helps us a lot as well to do many things. So go to the private and tell them that you are physio, you are in the process of Kuru. Can I practice here for number of weeks or whatever? So you should be able to get it.
So
But
I
this
think
will be unpaid.
if someone is
Unpaid.
if someone is in Pakistan, then I think it goes back to all your tips about how to find a job and how to write a CV and how to prepare for interviews. So thank you so much, Dr. Salma, Gul, and Afifa. Really glad, really thankful for you to volunteer for this. मुझे पता है बहुत टाइम लगता है इन चीज़ों को प्रिपेयर करने में, इनमें पार्टिसिपेट करने के लिए. So really, I really commend all those efforts. For all the audience, we might not be able to answer all your questions today. If something has remained unanswered, please email at info.ippa.ireland.ie. Please mention the name of the webinar in the subject lines, and we'll try to get back as soon as possible. So जो भी questions रह गए हैं, you can send an email to IPPA and we will forward them to Afifa Gul and Dr. Salma in due course. Yes, we have a lot of questions that can we get recording? Yes, you will get recording. Yes, you will get the slides as well. So again, thank you so much. I hope you enjoyed the webinar. I hope you found it beneficial and useful. And again, one last time, thank you so much, Dr. Salma, Gul, and Afifa.
Thank you so
I'm
much.
going.
Thank you.
And if the moderators and the speakers can stay back, I would request everyone else to leave the meeting room now. Thank you.
Thank you, everybody.
Thank you, everyone, for joining.